Good afternoon, everyone. This is Dr. Cynthia Crosser, and I wanted to take a few moments to share some nutritional strategies with you to help your immune system, to help you to be able to feel stronger in light of the pandemic, of the COVID-19 pandemic that we're dealing with. So we hear about the high-risk groups. So who are the high-risk groups? We understand, most of us, that it's the elderly, that people that have cardiovascular disease, that it's folks that smoke or already have lung disease or have diabetes. And there are obvious reasons for these types of things. However, March 10th in JAMA, the Journal of the American Medical Association, it was quoted that the average age of a positive COVID-19 diagnosis was 44 years old, not exactly what we would call elderly. So that kind of shed light on basically underlying weaknesses that could be there even when people are younger and do not have these other conditions, or perhaps they do. Another group, for obvious reasons, are our healthcare workers, because when they first go into a situation, as we've had, basically the adrenal glands kick in, cortisol's pumped up, which helps the immune system. But in time, the adrenal glands become somewhat weakened. When that occurs, now the immune system is somewhat downregulated and they become very susceptible due to the stress and its impact on the adrenal glands. And the adrenal glands do play a role in immune regulation. So looking at the bigger picture here, so I wanted to talk about a few nutrients today: melatonin, vitamin D, and vitamin C. So we'll start with melatonin. So there is an enzyme that is a protein that's within our white blood cells. That particular enzyme, NRLP3 is what it is called. When that particular enzyme becomes upregulated due to a challenge, such as a pathogen, such as this coronavirus, what will happen is that it will create a compound called an inflammasome. When the inflammasome is activated, that is when we have the cytokine storm. That's when we experience the high fever and all of what basically starts to take over the body. So what they have found in respiratory patients, actually in nursing homes, that when they were given melatonin, which many are, because many people in nursing homes actually don't sleep very well, that's not uncommon for people to say as they get older, what happened was that the cytokine levels, or the inflammatory compound levels, actually decreased as a result of them having taken that melatonin. So in terms of melatonin, we wouldn't want to give this to everyone because it is relatively age specific. So we don't see in children that are younger, between the ages of 1 and say 5, 6, 7, children have higher levels, which is why they sleep so much. As we get older, we have lesser and lesser levels. However, in places like nursing homes and as people get older, what happens is those levels will start to decline. And many people will additionally say they don't need to sleep as much. And that is definitely a correlation connected to the melatonin. In addition, as a person becomes very stressed, their cortisol will tend to rise. When cortisol rises, melatonin tends to go down. So in terms of the melatonin production within the body, that changes through the course of our lifetime. So if a person did in fact start taking melatonin, people ask about how much should they take and how long should they take it. It really isn't recommended, and it's not something I use very much in my practice at all, because it is in fact a hormone. And when you put that into the system, the body's actually going to produce less on its own. That's never what we really want to do. That's not what we're looking to accomplish. So ultimately, as far as the dosing, many times I may recommend 2 milligrams, 3 milligrams, 30 minutes before you go to bed. And you want to take it before bed, not through the course of the day, because as soon as you take melatonin, you're going to create that disruption between cortisol and melatonin. So we would want you to take that roughly 30 minutes before you go to sleep, but not to be in the light. We want you to take it in the dark. So to take melatonin and then go and sit on your computer or to watch TV is absolutely not the right thing to do, because what's going to happen is you may say, this is not effective, it doesn't work for me, and when actually you didn't really follow the appropriate process to make the melatonin be effective for you. So that's important. Now let's talk a little bit about vitamin D. So vitamin D is a fat-soluble vitamin. which actually for most people, I test it all the time, 25-hydroxy, and very few people have what is considered a healthy dose. There are multiple organizations that have different ranges that they consider normal. However, even the lowest range, which is what I usually will see on LabCorp blood work, most people are not even at the low end of the low. So that's never a good thing. Vitamin D has many functions in the body, but it has been touted as upregulating the immune system. And so in terms of how to get adequate vitamin D, well, first of all, vitamin D3, or what is called cholecalciferol, is the form that most people should get this in. In addition to that, it's one of these things that the body, once you take it, it stays within the body for a long period of time. So it's not, ideally, when a person's taking vitamin D, they should in fact be regularly checked to see that the levels that they're getting are not pushing them into too high of a dose. So why would too high of a dose of vitamin D not be good? The reason that wouldn't be good is because it would create very high levels of calcium. So what happens is that it's absorbed in the gut, and vitamin D will increase the absorption of the calcium. That is not good for folks that say have heart issues, things like that, to have very high levels of calcium. So again, another consideration that we have to think about with regards to vitamin D. So the key thing with vitamin D also is that with regards to vitamin D, people have different, what we call gene variances, or SNPs, single nucleotide polymorphisms. And these things can be tracked on genetic testing, even one such as 23andMe that so many people are familiar with. And so when we look at these gene variants, it becomes obvious that some people actually do not break it down. So they may need other nutrients to help them to actually break it down and have it absorbed in the gut. In addition to that, if an individual has leaky gut syndrome, which I know that I've got videos on my Facebook page and all that talk about leaky gut, again, you're not going to absorb what you think you're absorbing. So even if you're taking it, you may not be getting enough. So the bottom line is that if you were to go out in the sun and be out there for a good portion of the day, and I don't necessarily mean just sunbathing, your body is going to could make upwards of 70,000 international units of vitamin D just that one day in the sun, depending upon, the color of your skin. So all of those variables are important in considering how much and how often, and what your existing blood levels are that are connected to vitamin D. Lastly is vitamin C. There's a lot of discussion about vitamin C. Our bodies do not make its own vitamin C. So we can only get our vitamin C by way of either foods or by way of supplementation. So when we take vitamin C, most people, it's recommended to take it to bowel tolerance. So high levels, such as say 10,000 milligrams, is just a little bit too much for most people, or what would be 10 grams. What is tolerable most of the time is 2 to 3 grams, or 2 to 3,000 milligrams. And for some people, even less. What happens, or what they have found, is actually that when a person is taking fairly decent levels of vitamin C, that their hospital stays during an influenza situation decrease by 3.5 days. So in a situation like that, that is super significant in making a bed available for someone else that might need to be in the hospital during this crisis that we have going on, because of the fact that it does help to increase oxygenation, and vitamin C has been known to assist the immune system forever. So that really isn't something that's new. But the key thing is that in terms of how much we need to take, that varies. So when a person is under a lot of stress, the adrenal glands use more vitamin C than anywhere else in the body. And because we cannot manufacture our own, being under stress, our body has an increased need during a time of stress. So that would be an appropriate time to supplement. If a person does in fact develop this situation of the COVID-19 or some other health crisis, what occurs is that, again, we have an increased need for more vitamin C. So during those times, to have the adequate vitamin C that you would need to take to help your body to deal with this is very, very significant, especially with regards to the oxygenation component of the efficacy of utilizing vitamin C. So these are just 3 things that I wanted to mention to you and how they can benefit the body during this crisis. I only did 3 today, but I will be continuing to do more so that people will have some good background information as to the dosing, why these things are beneficial. I obviously use more professional brands than anything because I'm very familiar with using things and testing, retesting, and seeing improvements in my patients versus just taking and looking at symptoms. So I hope that this has helped you. However, in the big scheme of things, we come right back to those modifiable lifestyle factors that I share with my functional medicine patients, which is stress management, exercise and movement, adequate sleep. What are your relationships like? What is your nutrition like? What is your diet like? So those factors still basically are more important and super significant than just taking any specific supplement to help your body. In closing, I wanted to just make one statement to those of you that I hope have watched this. You know, this situation, I hope, has made people think about being healthier for the long term, because those folks that are going through this situation and have exposure and have these conditions, I'm sure many of them now wish they might have done something differently prior to 2020. And it's a lifestyle, it's things that, you know, slowly change, habits, things like that. In the end, every single day, I find it absolutely thrilling to work with people, to see them change, to see them get better, to see their eyes light up because there's life there again, because they're healthier, they're interacting with people differently, and it's just nice to carry people that way. Take care, stay well, and I'll be posting more soon.